Group of GIT drugs that we are going to discuss are the antidiarrheal agents. What are antidiarrheals? Antidiarrheals are drugs that decrease peristalsis of the GIT, thereby allowing fluid absorption from the intestinal contents. This helps to reverse diarrhea by decreasing the liquidity of the stool. So what are antidiarrheal agents? So these include anticholinergics, protectants and absorbents, and the narcotic analgesics. These are the different groups of antidiarrheal agents and their site of action. We have the anticholinergic, opiates, and the protectants and the absorbents. So these are the sites of action of the uh, protectants, and the absorbents. We also have the anticholinergic drugs and the opiates. Anticholinergics are used to treat tenesmus. So when we say tenesmus, that is straining during defecation. Uh, Tenesmus associated with colitis and vomiting related to colonic irritation. They decrease the GIT motility as well as its secretions. So anticholinergic drugs are common ingredients in antidiarrheal preparations because they significantly decrease intestinal motility and secretions. Because few of the types of diarrhea seen in animals can be classified as hypermotile, the use of anticholinergic drugs is limited in veterinary medicine. So these are the examples of the anticholinergic agents that are used as antidiarrheals. Now we have, of course, the first one here is the atropine. Atropine will decrease now the GIT motility in many animal species. Another group of drugs are the protectants and the adsorbents. So this works either by coating the inflamed intestinal mucosa with a protective layer. So that is the function of the protectants, or by binding bacteria and or digestive enzymes and or toxins to protect intestinal mucosa from their damaging effects. So that is the function of the adsorbents. Examples of the protectants and the adsorbents are the Bismuth Subsalicylate, kaolin pectin, and the activated charcoal. So for the Bismuth Subsalicylate, um, the bismuth portion, so again, it has two components. One is bismuth and the other is the subsalicylate. The bismuth component will coat the intestinal mucosa and has an anti-endotoxic and weak antibacterial effects. So it has a protectant effect. The subsalicylate portion has anti-inflammatory effects because it reduces the production of prostaglandins. For the kaolin and the pectin, so this combination drug has both adsorbent and protective qualities. So bacteria and toxins are adsorbed in the gut, and coating action protects the inflamed intestinal mucosa. We also have the activated charcoal. It is a fine black tasteless powder used to adsorb many chemicals and drugs in the upper GIT. We also have the opiates or the narcotic analgesics. So they are also used as an antidiarrheal agents. They control diarrhea by decreasing both intestinal secretions and the flow of feces, and increasing segmental contractions, thereby resulting in increased intestinal absorption. Side effects of these drugs include CNS depression, ill use, urinary retention, bloat, and constipation with prolonged use. These are the examples of the opiates or the narcotic analgesics. We have the diphenoxylate, loperamide, and paregoric. Diphenoxylate is a C5 controlled substance, so that it is usually added with atropine. We also have loperamide. So loperamide is an over-the-counter drug. And we also have the paregoric, which is also a controlled substance, a C3, that is usually combined with kaolin and pectin. So one of the most commonly used opiate drug as an antidiarrheal agent is the loperamide. It is important to note that loperamide should not be used in dog breeds known to be sensitive to ivermectin. For example, we have Collie, Australian Shepherds, Old English Sheepdogs. These dogs have a gene mutation that causes a functional defect in the P glycoprotein, which controls drug movement in many tissues. These drugs are also contraindicated in the cases of infectious diarrhea because slowing the GI transit time may increase the absorption of bacterial toxins. We also have the probiotics. So examples of probiotics are lactobacillus, enterococcus, and the bifidobacterium. So for their MOA, they are involved in competing with pathogenic bacteria for colonizing sites, production of antimicrobial factors, alteration of the microenvironment, reduction of the local inflammation, and alteration of the immune responses. This is the schematic diagram about the potential mechanisms whereby probiotic bacteria might perform within the intestine. So of course, this is the epithelial layer of the intestine, and these are the different mechanisms whereby the probiotics will exert its anti-diarrheal effect or its protective effect in the intestines. So it has, for example, will increase the mucin production or expression and induce an enhancement of the barrier function against bacteria. And it will also, for example, decrease the pH of the lumen. It also has some antibacterial activity and the immunomodulation property. Another group of drugs that are classified as antidiarrheals are the anaerobic antibiotics. And under this, we have the metronidazole. So, of course, metronidazole is a nitroimidazole. Its brand name is Flagyl. It is an extremely useful antibiotic and antiprotozoal agent that's been around since the 1950s. In both human and veterinary medicine, it has cured life-threatening anaerobic infections. Metronidazole is active against anaerobic bacteria. For example, we have the Bacteroides fragilis, Bacteroides melanogenicus, Fusobacterium, and Clostridium perfringens, and other Clostridium species. So it is also used, again, metronidazole is also an antiprotozoal agent, so it is used for many years in therapeutic management of trichomoniasis, giardiasis, and amoebiasis. So as an antidiarrheal agent, no, it is effective or it may help to return the animal stool to its normal consistency.